Hi there, Dr. Darrow.
Hey, Nita Valens, are you living it up?
I'm living it up. Are you living it up?
Always.
Yay. Well, we want our listeners to live it up, so we're going to help them out with chronic musculoskeletal pain issues today. And you can call and talk about your pain at 866-870-5752. And that means muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, toe pain, trigger finger, wrist pain, carpal tunnel stuff, tendonitis, stiff joints, dull aches, basically orthopedics. That number again is 866-870-5752, and we have lines open for you right now. When you call the program, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. The byline of the show is We Take the Surgery Out of Pain. In that book, there's 264 studies, scientific studies, actually. You'll love it. And you can also go to Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. What else would we like to do right now? Do you have a question pending?
Always. Always, always, always. Those that know me.
Let's do it.
When I walk into the door with a new patient, I give them my cell number, I give them my website, and I tell them to stay in touch with me, ask me questions. I get back to everybody usually the same day. I can't promise that, but often, mostly, I should say. And I do have a plethora of questions that people have sent me, and I just got some, and one of them is pretty amazing. It says hip labrum tear. What does that mean? The hip has a sleeve around the femur, the head of the femur, that goes into the pelvis, what we call the acetabulum, and that sleeve is fibrocartilage, and it can tear. However, just because it tears does not mean you have pain from that. And if you Google labral tear surgery, you'll see that the outcomes from the surgeries to fix them don't really work too well. And too many people go in and get these surgeries they don't need. Now, as you said, Nita, the byline for the show is take the surgery out of pain. That means don't go jump to a surgery when you don't need it. And unless you have a broken bone or something like that in the orthopedic realm, you don't need surgery. I know it is seductive, especially in these young athletes, because they think it's cool to get a surgery. And then what happens is the tissue is taken out. They break down whatever joint it is over the years. And then as they age, they're looking for a replacement joint. And I don't like those. They don't last. They wear out. They get infected. I've had a couple of patients die from joint replacements. So I'm very skeptical of these orthopedic surgeries. I'm not skeptical of orthopedic surgeons. I love them because they do some of the hardest work in medicine. It's very, very stressful to do these surgeries that have side effects that can happen to people. But at any rate, we treat labral tears all the time. I use cells from your own body, platelets. We call it PRP, platelet-rich plasma. Simple process. We just draw your blood. We spin it in a centrifuge, and we throw away the red cells, which are irritating, and then we inject the platelets into the area, which stimulate tissue to regrow. So I've seen tears all over the body that have healed by doing PRP and other regenerative medicine techniques. The newest techniques that we have, and I've been doing this for many years, are bone marrow concentrate, where we just go into the back of the pelvis, and it takes about 15 seconds typically to do it. and we can aspirate some bone marrow and then inject that. That has stem cells and platelets in it, along with all kinds of growth factors, cytokines, exosomes, all of these things you'll read about on Google. And then the newest thing I've been doing since last year has been umbilical cord stem cells. And, to be clear, none of these things are FDA approved. I'm not going to be reaching and trying to sell you a bill of goods that you're not getting. So FDA is going to supposedly, in a year from now or so, come up with guidelines for us. There is controversy whether the stem cells we inject are actually alive or not. But the good news is we're doing a massive study in our office, and Brent Shaw is our director of research. We have about 20 students or postgrads who are doing research for us, and we're going to have probably over 1,000 patients involved in this. And it shows that the bone marrow stem cells or the umbilical cord stem cells work statistically the same. So I can tell you I used to do 6 or 7 bone marrows a day, and now nobody wants those because they don't want that procedure of aspirating from the bone marrow, and everybody's jumping over to using the umbilical cord stem cells. I get maybe, one every 2 weeks where people say, I want to use my own cells, and we do that for them. So that's up to you. But what I tell people is that our research shows it doesn't really matter whether you use bone marrow or you use umbilical cord stem cells. They work effectively the same. And I know there are people on the internet, there are doctors that say that everything in the umbilical cord stem cells are dead when it comes to stem cells. But it may not even be the stem cells that are doing the work. It may be the other ingredients that are doing the healing. No one really knows the answers to these things yet. But at any rate, we do take care of hips. We take care of knees and shoulders and necks and backs, like you said before, Nita, toes and fingers, arthritis all over the body. And it's rare that I ever have to send a patient to surgery. It happens occasionally if you've got a joint that's totally locked up or smashed, then that's a possibility. But otherwise, we can usually help people. Not everyone is helped by this, but most people are. Usually the reasons people don't get a healing from these procedures is they don't do enough of it. And if you read something on the internet or talk to a doctor who says it just takes one treatment, I would walk away, because my experience is there are people that do heal after one treatment, but more often it takes a few treatments. It's like filling a hole with dirt. How many shovelfuls does it take? I don't know. Everyone is different. And then we've got the over-exercisers who get a treatment. They go back and start exercising or doing whatever activity caused it. Then they come back and said it didn't work. Well, it's working. It's growing tissue. We know that. If we did a biopsy, we'd see new tissue. But you got to listen to the doctor's order, and that is to back off and let things heal. So, Nita, do we have anybody here yet?
Not yet, but let me give the phone number again. Sometimes in the beginning, people are listening to get the gist of what is going on here.
And they're shy. Don't be shy. We get a lot of people that bulk up at the end of the show, and then I don't have time to talk to you. I do want to talk to you. I do want to help you. If it's not about you, your friends or family are open issues that we can talk about. And when you call in, you'll be helping everybody else listening. And this show also, this video goes on my website, which is www.lastemcells.com. That website has about 150 pages of information for you that you can read yourself or give to your doctor. More and more doctors are learning how to do regenerative medicine with platelets and stem cells. At some point, it will be the new tradition of orthopedic medicine. I don't know if this stuff works for diseases. I don't do that. I don't inject it IV. The FDA doesn't like that yet. and the medical board probably wouldn't like that, so I stick to orthopedics. And that's the safe way to go, and I've never had a problem with it so far. I've been doing regenerative medicine over 20 years, hard to believe, since my residency at UCLA, and I've used it on my body, on my shoulders, my knees, my elbows. I've had other people do my neck and back, and I've had amazing success on my body. I do have rotator cuff tears in my shoulder. I do have a labral tear in my shoulder, my right shoulder, and I have zero pain in that shoulder. As you can see me lifting my arm on the video, I'm doing great. I had to inject myself a few times, and I will go play golf later this afternoon. And if anyone wants to join me playing golf, you can get a hold of me through my website at www.lastemcells.com, and there's a place to email me there for those of you that are too shy to call the show or call my office. But you can email me. I get emails all day long that I answer through the website. Your turn.
Our number is 866-870-5752. That's 866-870-5752. And remember, you get your free copy of the book if you're somebody that likes to read about the research, and this is a new paradigm for you. This is it.
I do have some other news, Nita. We are going to be discontinuing our relationship with insurance companies. Oh. And we've got probably till the beginning of 2020, where if you want to come in, we are still taking Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare. And for those of you without insurance, we can help get you a credit card for medical procedures called Care Credit. Insurance companies typically do not pay for regenerative medicine, but at least it will get you your first visit and other things that we do in the office through your insurance. So hurry up.
Okay. All right. 866-870-5752. 866-870-5752. Don't be shy. You can find out about the chronic pain that you've been in. You know, sometimes, Dr. Darrow, people call in, they've been in pain for 5 years, 10 years, 20 years, even 30 years.
I've had people with 50 years. Can you believe that? 50 years of pain. And there's one man I remember who was about 80 who would come in. I said, how long have you had your back pain for? He said, about 50 years. I did one treatment on him, and this is not typical. I'm putting that out there. He didn't come back. And a few months later, I thought about him. I liked him a lot, and I called him up, and I said, how come you didn't come back? Did I hurt you? Did something happen? He says, no, you healed me, completely healed. He said, I should have called you and let you know. But he was doing well. So...
well, you know, one of the things that I think is very powerful is how you were training to be an orthopedic surgeon, and after your boss operated on your shoulder and it blew up and you were in pain for a year. I love that story because it really tells, like, not only how it changed your life, this treatment, but it shows how overnight it can change someone's life. So let's see, why don't we go to Santa? I don't see a name here, but let's see what we got. Hi, what's your first name? Santa? Hello? Frederick. There you go.
I've got a Frederick here. Frederick has a trigger finger, right, Frederick?
Yeah, yes, sir. That's correct.
Okay. Do you know if you have any arthritis in that finger?
It actually began while working in Italy. I go to my mom's hometown in Italy, and we have sort of this family property, and I was working with, one of those, I guess, weed whackers, where you're constantly with your finger.
Talk up a little bit for us, Frederick, so everybody could hear you.
Talk a little louder, please, Frederick.
Oh, I'm sorry.
That's good.
So just doing work in the field work in this Italian small town that I visit in the summertime for the last 5 years, I developed an issue with my finger.
Okay.
Where it just clicks. It's sort of when I make a fist and then try to extend my fingers, my middle finger won't.
Okay. So there's a
push
couple
up.
things when we look at that. We look for arthritis, and then we look for the tendon that gets stuck in what's called the A1 pulley, and those are the two main issues that can affect you. If it is arthritis, then I would use either platelets from your body or stem cells to heal that up and regrow some of the cartilage. If it's a trigger finger, that's something that doesn't work so far that I know of by regenerative medicine. We stick an anti-inflammatory in there with some DMSO. That's dimethyl sulfoxide, which is like a horse liniment. And that'll take that anti-inflammatory to permeate that nodule that you have there. Are we in a
Yeah. I'm curious. Is it something that comes from the elbow?
It could be, but usually not. Yeah, there are tendons that come from your elbow that are attached to muscles that are attached to fingers through tendons. But you need an examination by someone who does regenerative medicine to see if they can help you. I would go to the website to start your quest. That's www.lastemcells.com. And you can email me from any page there, and I'll get right back to you, and we'll figure out what's going on with you. If you want to come into the office, the phone number is 800-300-9300.
Okay. And the website again, sorry, LA.
The website is www.lastemcells.com.
Okay. I appreciate that. Thank you.
Sure. Glad to help you out. If you want me to take a look at it, give the office a call. Come on in. Like I said, we are taking insurance until at least the end of this year. And after that, we're going to be dropping it. So if you want, I'm not going to call it a free visit because we can't do that. We're not allowed to. But if you want your insurance to pay for it, get in before the end of the year for me to take a look.
Great.
Thanks for your call, Frederick. Our number is 866-870-5752. That's 866-870-5752. And we'll go to Ellie in Manhattan.
Hey, Ellie, this is Dr. Marc Darrow. I understand you've got pain in your shoulders. Your left shoulder or
nice
right?
Nice to talk to you. Thank you very much.
You too.
Well, I've had a terrible pain on my left shoulder. I've gone to therapy. I've gone to chiropractic. And now my doctor has given me some cream to put on it, and it seems to help.
Okay.
But I know that it has side effects, which I don't really like. And I also have a right knee that I have been looked at for in the chiropractic practice for the last, months and months. But
Okay.
it doesn't seem to help. So
Okay.
I'm at a loss of what to do. And I'd like to be seen by you and see if maybe you could help me so I can walk normally.
Sure.
And sleep well.
Sure.
How's that?
So first of all, I love chiropractors. I'm one of the few MDs that likes them, but I actually had
I love them too, but
they're amazing. I actually go to
It
chiropractors.
hasn't alleviated my problem.
Yeah. I want to throw out the name of a chiropractor in Santa Monica you may want to go see if yours isn't working. His name is Randy Weinzoff.
Well, if they'll take my insurance, I'll be happy to go see them.
Yeah. I'd like to look at you also. And my office phone number, if you want to call in, is 800-300-9300. And we'll figure out what's going on. I get tons of referrals all the time from chiropractors when they can't help the patient anymore. And usually we can help you using
great.
regenerative medicine.
I think I would have to have an approval by my primary care doctor. Is that right?
Do you have an HMO or a PPO? Are you Medicare?
Yes, I have an HMO.
HMO will not cover you at all. I don't take HMOs.
Okay.
Yeah, I'm sorry.
Well, I'll talk with one of your representatives.
Call the staff.
Charge me.
Call the staff and let's get you in and let me take a look. And the main thing is, do you have any range of motion in your shoulder? Can you lift it up over your head?
I can.
Okay,
there was
good.
a time when I could hardly do
Lift
it,
it.
but I can. But when I do, there is lots of pain right underneath the arm going down
Sure.
into my body.
Okay. Well, I've been there. I've had both my shoulders locked up over the years, and I've healed myself using regenerative medicine. Yeah, I know exactly what it feels. I'm a sports addict, and I don't know if you heard me earlier in the show. I have healed both my knees, both my shoulders, my wrist. I've had other people do my neck and back, but I self-inject whenever I get injured. And unfortunately, that's far too often. But I don't stay injured because I inject myself with platelets or stem cells.
How do you get these stem cells? Where do you get them from?
Well, there's two ways that I do it.
Them into
Yeah, there's two ways I can do it. I can either put a needle into the back of your pelvis at what's called the PSIS, and then aspirate out your bone marrow. A very simple procedure. Once it's numbed up with some lidocaine, it takes about 15 seconds to do it. And then I can inject that into the shoulder or your knee. And the other way is easier for the patient, which is to take your platelets from your blood, spin those, and then mix it with umbilical cord stem cells that we purchase from a company in Tustin. It's called Invitrix, if you want to look that up. It's a giant company that's been doing this for 15 years. And what we find in our research is that the stem cells from the umbilical cord or from the bone marrow from the patient, the efficacy is the same. The results are exactly statistically the same. So I can't say one is better than the other. They're both good. Okay?
Can I ask you, where do you get the stem cell from the umbilical cord? From a fetus?
No. If it's from a fetus, that's called embryonic. That's illegal.
Oh, I see. Okay.
Yeah,
So
we can't kill babies or abort babies to get stem cells. That's illegal, right? And we get them from moms who donate the umbilical cord at the hospital.
Oh,
we don't. Yeah, they're live babies, of course. And it doesn't touch the baby. It's just the umbilical cord that they're going to throw away.
Yes,
the moms donate them to the hospital.
I've had 5 children.
Good for you. I've got 5 also. But the way you did it was tougher than the way I did it. Yeah, so.
And they're all healthy, thank God.
Thank God, yes.
Well, I will call your office. I'm interested in that. And,
okay. And you can walk okay, right? Your knee works? You can walk and bend it and all that?
Oh, I can walk, but sometimes I'm better than others, at other times. And a lot of times I feel like I'm a cripple.
I hear you, yeah.
When I go to Costco, I say, oh, where's that motorized cart? I can't
well, that's smart. Yeah, if your knee is bothering you, you should get one of those carts. We can probably help your shoulder and your knee. And if you want to come in, we'll take a quick peek and see what's going on. And I can advise you from there.
I'll call your office. Thank you very much.
God bless you. It's a pleasure talking to you, Ellie.
Thanks, Ellie.
And it was. Thanks.
Appreciate your call. Okay, we have to take a quick little break here on Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back with more of your calls.
And Paula and Sandy, stick with us.